Hi, it's Eric Robbins, and I'm so excited about being able to make this video for you. You know, it's been 25 years that I've been involved in mind-body healing practices, and this year is actually my 25th wedding anniversary. And I remember telling Linda the year we were married, I said, I want to become the best mind-body healer in the world. Now, 25 years later, I don't think I've gotten anywhere close to that, but I have made a number of distinctions, and I've been honored and blessed really to have a big medical practice where I get to use, the best standard of care medical treatments for my patients. And for those who need something else or where standard medicine is not helping, we're able to incorporate a whole series of mind-body techniques and practices. So I was thinking recently, what would the me of now want to tell the me, the Eric in 1992. I was a fourth year urology resident at USC, and just started to incorporate a lot of this stuff into my practice. I just taken a little bit of hypnosis classes. So these are some of the big mind-body points that I want to share with you that I would have shared with the Eric of 25 years ago. The first concept is the idea of neurologic stress thresholds. And let me explain this in the way of a model that I use. So a neurologic stress threshold means that all of us, our bodies and our nervous systems have a certain threshold for how much stuff we can handle coming at us from life. And when life gives us more stuff than we can handle, when we get pushed over that threshold, it creates this generic stress or anxiety feeling in our body. And then all of us learn to cope with that differently depending on how we learn to respond as kids. So sometimes we're pushed over a threshold and people get angry, irritated all the time. Other people get anxious. Other people get depressed. Some people isolate themselves. Some engage of any one of a number of addictive behaviors, but all these things we could say happen because we got pushed over that threshold. Now, another way I like to think of neurologic stress thresholds is this. You could think of our nervous system as being like a cup or a plate, and how much stuff can that cup or plate hold before it gets full, before we get pushed over that stress threshold. One of the reasons why I tend to be good at this mind-body stuff is that I grew up and for much of my life, my neurologic stress threshold was the size of like a 1 ounce shot glass. And that doesn't mean that I used to drink. I've never drank alcohol. But it's just a metaphor. I couldn't handle very much stuff without getting pushed over that threshold and feeling and acting in just bad and dysfunctional ways. Now, everyone gets how bad, negative stuff fills up our cup or plate. But for some people with really small cups, even seemingly good or positive things, positive energy, love and intimacy, good health, financial success, things like that, seemingly positive sources of energy, if we have a really small cup or plate, can feel overwhelming to the nervous system and feel bad also. That's what psychologist Gay Hendricks describes as the upper limits problem. And I'll give you a few examples that either myself or many of my patients can relate to or know somebody who this takes place in their life. So the first thing is you think about a couple who's going to go away on a romantic 3-day weekend. And right before they leave, a fight breaks out. And at one level of truth, you could say, she could say, well, he really was being X, Y, and Z. And the husband could say, yeah, she was being this and that. So there was a seemingly good reason for the fight. But at a higher level of truth, you could say the fight had to break out to limit the amount of positive energy that they might have experienced. A second real common thing is that, someone has an upcoming vacation and right before they have a 1 or 2 week vacation off from work or they're planning to go somewhere, somebody gets sick. And again, on one level of truth, you could say, well, this person, yeah, they really did get the flu or a GI bug. On another level of truth, you could say the illness had to happen to limit the amount of positive energy there would have been with this vacation. So those are a couple examples of how things relate. I remember back in 2000, I was at a medical meeting in Hawaii, and we were staying in Maui at one of the nicest hotels. They even had penguins in the lobby of this hotel and all these exotic birds and stuff, and it was so carefree. And because it was a medical trip, it was even a write-off, which is even better. And my wife Linda was there, and Jonah was there, and Linda was just being so kind and loving. And I noticed I was just in a mad, pissed-off mood the entire trip. She's looking at me saying, what's going on, man? Why are you so upset? That was a prime example of the upper limits problem. So the question is, what can we do about upper limits problems? I want to say one other thing. There's somebody who I've trained with named Sylvia Hartman. She was one of the pioneers of the EFT movement. She's developed a few other techniques, one of which I'll talk about later in this video. But Sylvia talks about the concept of stress thoughts. And the idea of stress thoughts is this. She says, when we're stressed, we have a bunch of thoughts and emotions running through our heads that we wouldn't normally feel. You know, stuff seems globally bad. We might feel like, man, I'm the worst person in the world, the worst parent, the worst spouse, the worst coworker. And we just got this string of just thoughts going through our heads, none of which we would feel or think if we weren't stressed. So again, when we're physiologically stressed, we tend to have these stress thoughts. Now, the other interesting thing is that folks that have undergone big stresses or traumas early in their life, early in their childhood, there's physiological and neurological changes that affect the size of our cup or plate. So folks with early traumas, you may have a very, very small plate. Now, what do people do generally when they're stressed out, you know, when they're anxious? Well, they may go talk to a therapist. That's really good. That's like dumping out the cup or plate. They may do tapping. That's also good. There's a whole wide variety of things they do. Some people take medications. The paradigm shift here is, what if we could actually get a much bigger cup or plate? That's a paradigm shift. What if the size of your cup went from the size of a thimble or the size of a 1-ounce shot glass over time to the size of maybe a 64-ounce big gulp? Then your nervous system could handle a lot more stuff coming at you from life without any of these dysfunctional feelings or behaviors coming up in the first place. So how do you get a much bigger cup or plate? Now, in my experience, and what I'm sharing here is just my opinion and experience. In my experience, there's two things that I found that are very effective at giving you a much bigger cup or plate. The first is a sound technology called binaural sound technology. You use stereo headphones. It makes changes in the brain waves that I'll talk about in a minute. And in my experience, that's very good at over time, it's a process, giving a person a much bigger cup or plate. The second thing that I found for me personally and for a lot of my patients that does it is a practice called the TREs. This stands for Tension and Trauma Release Exercises. These were developed by one of my teachers, and now I can say a friend, Dr. David BERCELI. So let's talk about binaural technology first, what it is, how we use it. Basically, back in the 70s, they did some experiments with sound, and they found out that if you put on stereo headphones and you play a slightly different frequency in each ear, for example, 400 hertz in this ear, 405 hertz in this ear, that whatever the difference is between those two sounds, your brain waves would be entrained to go to that level. So 400 in this ear, 405 in this ear, the difference is 5. They can entrain your brain waves to go to 5 hertz, which, for example, might be theta waves. Now, most of us, our normal waking brain waves are in a beta state. That means the sound waves are very fast, but they're small little waves, but they're fast. As we slow the brain waves down, we go into an alpha state, which is like what you get in hypnosis or kind of just as you're falling off to sleep. That's an alpha state. You can focus and concentrate better. Next, we go into theta, which is normally associated with REM sleep. A lot of kind of big intuitive creative bursts come to people frequently in theta. You can start recognizing patterns that you've been stuck in your whole life when you're in theta. Then the last state is called delta. Now, delta is normally associated with deep, dreamless sleep. So beta waves are these small waveforms, but they're very fast. Delta are these huge waveforms. They're slow, but each waveform contains a tremendous amount of energy. So basically, using sound technology, they can lower your brain waves down from beta to alpha to theta and all the way down to delta and hold you there very consistently. Now, they looked at very advanced yogis and hooked them up to EEG machines. They found that if you have a yogi who's maybe spent 6 hours a day for 15 years meditating, they can just get to the point where they can lower their brainwaves down to delta and keep them there. The first time you listen to the technology, you can get the same brainwave patterns that it took somebody 6 hours a day for 15 years. So what's the significance of lowering your brainwaves down to delta? Why would you want to do that in the first place? Delta waves contain a tremendous amount of energy. So if you hold someone in a delta pattern, you're essentially forcing the brain to have to handle a lot more energy than it's normally able to handle the way it's currently structured. So there's a few things that we think happen. Number one, the brain increases the communication between the two hemispheres. It increases cross-hemispheric communication. Now, you probably heard most of us are either predominantly left-brained or right-brained. So that's fine, except some people are very, very lateralized, like we're very concrete and literal, and others are very kind of abstract and in the creative side. And they've shown that it's very difficult to be stuck kind of in a depressed, anxious state if you're looking at life through a whole brain state. So you listen to the sound technology, what it seems to do is increase the communication between the hemispheres. They've seen this in EEG studies. So we begin to look at life through a whole brain approach, and it's really tough to get stuck there. Other things that happen as the brain is forced to have to handle this increased energy from being held in a delta wave pattern, it increases kind of the development of new neurologic pathways throughout really the brain and the whole nervous system. And I found that it's just kind of some of these deep-seated unconscious patterns that I wasn't aware of as I was developing new neurologic patterns. They seem to kind of come unstuck and make it up to my conscious awareness where I could deal with a lot deeper things. They also increase your ability to kind of have this witness perspective, because all of us, it's very easy to stay to stay calm and patient when things are going right, but when things take a turn for the worse, it's like we kind of get caught up in our emotions and go from using our logical, rational neocortex to more of our emotional limbic system and reactive brainstem. And if we're able to stay in kind of that witness frontal cortex, neocortex more often, we can handle things more logically and efficiently and not get caught up in our stuff and say stuff that we wouldn't like. So I love binaural technology. There's two brands that I found that I like. There may be others. And obviously with anything you do, check it out. There's risk and benefits of anything I mention. I always tell patients there's risk and benefits of driving to the office to see me. So one is a product called HoloSync. That's the one that I listen to. I think that's the Rolls Royce. Their website is Centerpoint. There's an E on the end of point.com. The other is a system called Perfect Meditation. I've listened to that one as well. I like it as much. Perfect Meditation is about 1/3 the cost of HoloSync. HoloSync has more kind of coaching you can avail yourself to, and Bill Harris, who's the head of Centerpoint, is a friend of mine. He's a great guy, and he's a brilliant guy. So the second thing I want to talk briefly about the TREs, tension and trauma release exercises, and I'll tell you briefly how I got into those. I found myself about 3 years ago very, very sick. I had some these very serious neurologic issues coming up. I was having some cognitive issues. Couldn't feel the hot water in my hands in the shower. Had this weird twitching. I was not functioning that well. Around the same, and I was actually very, very concerned about that. Around the same time, I was sitting in the office one day, and I prided myself because I made it to age 50, no medical problems, no medications, and most 50-year-olds that I see have a whole boatload of medications and medical problems. So I'm sitting in the office one day, and out of the blue, bam, my heart started racing at 220 beats a minute. And I was getting dizzy and lightheaded, and I got sent to the emergency room and admitted overnight. And basically, what they're calling it is a PAT, a paroxysmal atrial tachycardia. And as I'm laying there in the hospital, one of the doctors came by and rounded, and what he said to me, he didn't say quite in the words I'm explaining it to you. I got the sense that my body was locked in this fight, flight, freeze state. Now, that's not really what I learned in med school. In med school they teach us if you're out in the woods and the bear jumps out, or you're somewhere in the mug or the rapist jumps out, you literally either go towards the target and attack it, or you flee and run the other way, or if you can, if something's happening to a little kid and they can't escape, they can't fight and they can't flee, they'll physiologically freeze. They may dissociate mentally. Certain parts of the body and musculature tend to lock up and get tense and tight to decrease kind of energy flow in our experience of that situation. Our physiology gets put into this fight, flight, freeze state. The thing is, in med school they taught us, but assuming that you survive and make it past the bear, you escape the mugger, whatever, that your physiology is supposed to normalize. But what I realized that day in that hospital bed is that for a lot of us, a series of either big T, big traumas, or a series of little T's, little stressors and traumas put our body into this fight, flight, freeze state, and that it stays on autopilot and doesn't just turn off. So that was a real epiphany to me, and I realized, hey, Eric, you're stuck in a fight, flight, freeze autopilot, probably as are most of your patients that are certainly that are chronically sick and that are not getting well. I've always thought the body tends to heal itself, and if you get a cut on your arm, that's going to heal. But a lot of folks with chronic problems and chronic illnesses don't heal. And in fact, I was reminded of something I read in one of Bruce Lipton's books a few years ago. Bruce Lipton's a cell biologist, and he says that when our body's in this stress state, the cells are just in survival mode. And it's not until we shift out of that stress state into more of a parasympathetic rest and digest healing state that the cells can heal and regenerate. So I'd always thought, my body knows how to heal itself. It was not doing a very good job at that point. And then I realized I've got to shift out of this fight, flight, freeze autopilot so my body really can heal itself the way nature intended it to. I didn't know how to do that though, because the challenge is there's nothing in standard medicine that shifts us out of a fight, flight, freeze autopilot. At least nothing that I'm aware of. I don't think there's any medications. I'm not aware of any standard therapies or psychiatric medications to do that. So I was really asking and praying, how can I shift my body out of a fight, flight, freeze autopilot? And that's when I came across the TREs, Dr. David BERCELI'S tension and trauma release exercises. A brief gist of these exercises is this. If you look in nature at the lion chasing the gazelle, I'm sure all of you have seen that on TV a million times. So that's obviously a life or death chase for the gazelle, right? What's interesting though, if the gazelle escapes and gets to a safe place, what it will do, its body will shake and shiver and tremor. And they found out that every animal, every mammal, all of us, our bodies have this built-in shaking or tremoring mechanism that seems to do two things. Number one, the gazelle obviously just ran for its life. It's in a high state of fight or flight. These tremors seem to downregulate the nervous system. They seem to calm down the nervous system and prevent it from going into this fight, flight, freeze autopilot that so many of us would go into if we had a big trauma like the gazelle did. The second thing, just in general, when we're stressed or tense, certain parts of the body tend to lock up and freeze and contract. And an analogy I always give for this is if you think of little Johnny, and Johnny's 2 or 3 or 4 years old, and mom or dad's really upset, And even though from the adult's perspective, it may not seem like it's that big of a deal, from the kid's perspective, it's a huge thing. It feels overwhelming, terrifying. And the kid probably can't fight or flee, so Johnny will freeze. Part of what happens with that is that certain muscle groups throughout his body will lock down and get tense and tight just to feel like he's getting so overwhelmed that he's dying. These muscle groups lock up. Now the interesting thing is that 20 or 30 years later, little Johnny can be at work and his boss is yelling at him and eliciting the same types of fear, anger, whatever that his parent was doing many years before, and Johnny will notice, God, my neck and shoulders are getting tight and tense. So the same muscles which locked up and tightened years or decades before, when the same type of emotion is elicited, we tend to develop these tension and bracing patterns in our bodies. Now, many people are really good at this. If people that have chronic myofascial pain, chronic musculoskeletal pain, fibromyalgia, in my experience, a lot of those folks have these chronic tension and bracing patterns in the musculature. By the way, none of these problems are, quote, in someone's head. Just to be clear, we're not saying that at all. These are patterns of tension in the body. It is true they tend to come on when the same types of emotions are elicited that cause them to begin with, but none of this is, quote, in someone's head. We're talking about physical, physiologic pain, spasm. When a muscle is chronically tense and tight, there's less blood flow, there's relatively less oxygen. It causes a very real severe physical pain, okay? The TREs also seem to, over time, it's a process, unwind these chronic tension and bracing patterns in the body. I remember years ago, I actually fired a couple different body workers, massage therapists, because I was kind of this big mind-body guy, and they do massages on me, and they'd always tell me the same thing. They say, Eric, you're bound up. It means my muscles in my neck, shoulders, back were so locked up and spastic that they really had to do a lot of work and dig in their elbows and all this stuff. But of course, as a mind-body guy, I didn't want to hear that. I always say you can BS a lot of people, but you can't BS your body worker because they know if your muscles are tense and tight. I'm happy to say that over time and doing these TREs, a lot of the musculature is slowly over time relaxing, got a lot more energy. I used to feel like I was getting sick, I'd say 3 or 4 times a year, and it's been about 1.5 years. I've not had any colds or flus, and I attribute that directly to the TREs. So I'll leave a website on this video to kind of show you how you can find out more about the TREs. The power of working with raw sensations. What is that, man? What does that mean? What are you talking about, dude? So this is the deal. I was with my son Jonah at a Jeff Foster event a few years ago. And for those of you who don't know, Jeff Foster is a young guy. He's probably in his 30s, and he's a pretty well-known non-duality spiritual teacher. So he was doing some teachings, and this woman in the audience raised her hand. He called on her. So tell me what's going on. She said, well, my life is horrible. I'm depressed. I'm anxious. And he said, why? She said, well, my son has just spent his whole life getting in trouble, and he's addicted to drugs, and I think he robbed somebody to pay for his drug habit, and he's currently locked up in jail, and he's miserable. And then she said, and I'm miserable. So Jeff did something very interesting. He said, well, I want you to notice right now in this moment, how do you know you're miserable? Where do you feel that in your body? And she was forced to go inside, and he actually wanted her, he talked her through this, he wanted her to start noticing the sensations in her body that told her she's feeling bad. And so it took some coaching, and she kept saying, well, there's something in this anger, and I'm guilty, and over this and that. He said, you're adding a lot of layers of thought to that. Right in this moment, you're telling me you feel bad. Notice, this was his words, quote, notice the raw physical sensations in your body in this moment, unquote, period. Okay, again, it took some coaching to do that. Now, basically, what he was able to do was work with these sensations, okay? Let me tell you what so many of us do to keep from just feeling raw sensations, because I really think most of our emotions actually are raw sensations. Sylvia Hartman teaches basically all emotions are really just blocked energy in the body. They're just sensations. What would have saved me, I wasn't in therapy for 20 years, but as I always say, what would have saved me 20 years of pain and stuff was slowing down the process of what was going on with me emotionally and noticing raw sensations. So let me give you a perfect example of this. A lot of us growing up in good homes and bad homes, a lot of us, I'd say probably most of us, before age 4, have something that happens in our family of origin that causes a great deal of pain. Now, that does not have to mean you were molested. I had a woman in the office recently, and I was asking her if there's any trauma, and she said no. And then what that meant for her is, no, I wasn't molested. But her dad was alcoholic, used to come home every day. They all lived in fear. He was a rageaholic, and he beat the mom. But she was not molested, so she didn't think there was any trauma. So we all grew up in at a young age. The majority of us probably have something that happens that, from our perspective as a little kid or infant, feels overwhelming. It feels horrible. We feel like we're going to die. We feel like it'll never end. There's nothing we can do about it. We're helpless. It's a situation we probably can't fight or flee, if that's applicable. And I call this our deep pain. Now, some people truly have, objectively severe, horrible things happen. Ritual cult torture, they are molested, they're beaten on a regular basis. Other people, there's just a lot of tension in the house between the parents. Sometimes the primary caretaker is distracted because of their own psychological issues or relationship issues or financial problems or substance abuse, something like that, and can't be there for the kid. We call that developmental trauma, that just the primary caretaker can't be there for the kid, or the kid's upset, and the caretaker themselves is not physiologically regulated. Their presence does not calm down the infant. I call this our deep pain. Now, what Gay Hendricks talks about in his books is that we have a deep pain, and most of us develop a persona or a mask. It's a way of being, a way of acting that helps protect us and helps us survive in our family of origin. Okay, we usually develop this persona. Gay says that the attributes, so you'll know if you or someone else is acting out of having kind of a lot of persona, if there's a big need for approval, control, or blame. You see, those three things tells you that you're acting out of persona quite a bit. So we manage to take all these painful feelings, our body locks up, we develop these personality traits to protect us from ever feeling that again. Now, the challenge is, most folks at some point in their lives, that deep pain starts to come up to our conscious awareness, okay? There's something called the 7-year itch, which means for a lot of folks, once you've been in a relationship or married for the first 6 years and 364 days, everything's glorious. We're kind of blind to the other person's negative features. And then at some point, our deep pain starts coming up. when it first is coming up, we're doing a good job holding on the surface, it's coming up, and we get little twinges of these very painful emotions. Frequently, you're feeling bad, you see your spouse. You're feeling bad, you see your spouse, and all of a sudden you're like, oh, it's my spouse that's causing this pain, for example. And then we want to do all sorts of things and behaviors and discussions and express ourselves in ways that may not be that positive, okay? A lot of folks just get to their mid-30s. That's when it happened to me, mid-30s. And at that point, you just don't have enough psychic energy, is how I describe it, to hold down all this deep pain and still function in your life. So it starts coming up. Now, many of us who learned how to avoid feeling that pain by being contracted in our bodies, the pain starts coming up, we start contracting more. And then all of a sudden we have back pain and spasm, or we develop fibromyalgia or chronic myofascial pain. Again, those diseases are real, but the higher level question is, why is that happening? It's a tension, a bracing pattern to keep from feeling our deep pain. Okay, so I'll tell you a story that I think exemplifies this very well. So my deep pain started coming up in 1997. We had been married about 5 years. I say that I was on the fast track. I couldn't wait till 7 years of marriage. So the deep pain started coming up, and I just noticed I was feeling like crap. It was this nebulous feeling. It felt overwhelming. It felt horrible. I would feel bad, and I'd see Linda, and feel bad, and I'd see Linda. And I started thinking, my God, it's her that's causing my pain. That was the first thing. Then I had all these thoughts rotating through my head about why I couldn't allow myself just to feel the pain. I thought, well, this pain's clearly due to my spouse, but I can't allow myself to feel it, because if I do, it's so bad, we'll certainly get a divorce. My parents got divorced. I swore I was never going to be like them. We'd have to split the money and the assets. My son would be raised by a single parent. And I had all these layers of thinking about and figuring out related to really just this pain that came up. In fact, I remember we went to a movie one night, and in the middle of the movie I had a panic attack, and I had to rush to the bathroom. I stumbled there. If you've ever had a panic attack, it feels like you're dying. The thought that really saved my life at that time, I somehow had the thought or intuition, it's okay to trust the truth of what you're feeling, meaning sensation, without attributing a why. That allowed me to open up and not resist the feelings and sensations I was feeling, but I justified it or whatever by saying, I don't have to blame Linda right in this moment. So, that expression that what we resist persists, I was able to open up to feel those sensations without necessarily attributing a why. Now, it took a lot of work subsequently to get in and process my deep pain, but the first step is to stop resisting it. Now, if the me of now were to go back to 1997, I would have looked at that guy and said, listen, you've got some very horrible feelings that are coming up. It feels like you're dying. Feels like it's never going to end. You feel like you're going to go crazy if you open up to it. But I want you to notice those things as raw physical sensations in this moment. Allow yourself to feel them. Don't resist it at all. But what we're not going to do, we're not going to put a label on, whether it's labeling a name for an emotion, that's anger, guilt, sadness, hurt, fear. We're not going to add a meaning to the sensation, because in my case, the meaning meant it's Linda, and then all these things would happen if I believe that meaning. We're not going to try and figure it out. You're just going to open up to sensation. At that point, you can do meridian tapping, you can do the tapas acupressure technique, you can do emotrance, which I'll talk about as the third part of this video. There's a lot of things you can do at that point to deal with the raw sensation. Now, interestingly, what I learned a few years ago, something interesting, and that is that there was a psychologist, I think at University of Chicago in the 80s, named EUGENE, and he's developed a process called focusing. But what GENDLIN did back at that time, he was very interested to know which patients benefit from psychotherapy and which don't. Because you guys probably know, a lot of people don't benefit from therapy, and a smaller percentage do, and they really benefit a lot. So he's trying to figure out who benefits. He looked at hundreds or thousands of hours of, first of all, they found patients who they thought did benefit immensely by the patient's and the therapist's own standard, compared it to folks who did not benefit. And they looked at video and audio and transcripts and this and that, and he was able to boil it down, and he figured out you could decide in the very first therapy session, who was going to benefit from therapy. So who was it? Do you know what they said? I thought this was fascinating. GENDLIN said the patients that are going to benefit from therapy in the very first session, the therapist would say, "What's going on, man? what's bothering you? The people that benefited from therapy would do this. They go, I just kind of have this kind of weird feeling, in this area. Just kind of this weird feeling. So what have we been saying? What these patients were doing is noticing raw sensations in their body. GENDLIN called this a felt sense. What they weren't doing is feeling a sensation that their minds were immediately labeling it, adding meaning, thinking about it, trying to figure it out, making metaphors out of it, launching into all this craziness. They stayed at the level of sensation, and I'm telling you, that is really a fast track. There's definitely times when a story is a story may be beneficial, but I'm talking about just as a general principle. It's also very useful to notice sensations without adding all these layers of thinking about, figuring out, and all this other stuff that so many of us want to do. I remember even with my pain patients, I'll give you an example. I had a patient that came in a few years ago. Now, by the way, I was not able to help this particular patient. Was not able to help her. She came to see me, though, had seen many, many other pain specialists, and I walked in the room. She said, Dr. Robbins, I just want you to get a chainsaw, cut off the lower part of my body. Just cut it off. It's that because there's so much pain in my pelvic area. So we're talking, I did a little bit of an intake, and I was trying to figure out what is the actual raw physical sensation that was going on in her pelvis that she was, first of all, labeling as pain, and that was so bad and refractory that she wanted someone just to cut off her lower part of her body, and I guess she'd wheel around in a little platform with 4 wheels or something. At any rate, it took some distilling this down. But anyway, do you know what just this severe, horrible thing that she wanted us to cut her in half was? At the end of the day, what it was, there was a mild throbbing pressure in her vagina. That's it. So I want to take a snapshot of that. Okay. So let's slow this down, a million times, because a lot of times these things, we do them in our head in a millisecond. By the way, that's why meditation and mindfulness meditation or something like Holosync is so good. It allows us to have that awareness and separate our mind from our thoughts and emotions and just exist as awareness. So I love meditation. I've been meditating for 30 years regularly. Anyway, number one, this woman had in her words, a mild throbbing pressure in her vagina. Immediately her mind would label it, oh, that's pain. That's a horrible pain again. She would start thinking about it, trying to figure it out, remembering all the other times she was in the emergency room, and it was launching her body into this fight-flight frenzied state. It was driving her anxiety levels through the roof. Of course, when we're severely anxious or severely angry or scared, and our body goes in this fight-flight state, the stress hormones are released, and those have a huge impact on sensitizing pain fibers. So, again, what I tried to do, unsuccessfully in her case, was to start to separate out raw sensation from the thoughts, emotions, mental pictures, everything else going on that was making it so bad. Because all pain, there's raw sensation. Now, what I'm talking about here, by the way, is chronic pain. I'm not talking about acute pain. I'm not talking about pain caused by someone with, God forbid, a cancer eating away at a part of their body, or pain from a ruptured appendix, or broken bones sticking out through your leg. That's not what I'm talking about. I'm talking about, here, chronic pain that nothing serious has been found. There's no evidence of a tissue damage that's causing the pain, and how we approach that. Anyway, so that's another example. I see that a lot with my pain patients. Many of them, once we're able to kind of break it down into this, non-duality spiritual teacher Scott Killaby talks about the Velcro effect. There's a sensation, our minds Velcro it with thoughts and emotions, and it all sticks together. And in his method, and at his center in Palm Springs, he slowly starts peeling the layers apart. And it can be enormously useful for our patients. Nick Ortner, in his book, The Tapping Solution for Pain Relief, talks about using meridian tapping to tap on these thoughts and emotions that we have about the pain or about the physical sensation. Enormously helpful. Mindfulness meditation, when those practices are applied to chronic pain, number of studies show it's very beneficial. Love it. Okay, I want to tell one last, I want to talk for this third part of this video about something called emotrance. A newer name is energy in motion. It was a process developed by Sylvia Hartman, and I'm actually a certified trainer with her organization to teach it, and I use it a fair amount in the clinical setting, along with everything else that we give, which was the standard allopathic medical regimens and all that stuff. So I'm going to talk about emotrance, developed by Sylvia Hartman, and another newer name for it is energy in motion. So there's a few presuppositions that we're using here. Hopefully these will relate to everything I just spoke about. Sylvia Hartman says what emotions are is the feeling of stuck or blocked energy in the body, or a feeling of kind of an injury to the energy body. She says that is what an emotion is. It's a stuck or blocked energy, or it shows you where there's an injury to your energy body. The only thing I would add to that is that in my opinion and experience, the biggest thing that blocks the flow of energy to begin with is areas of chronic muscular contraction in the body. I think when something's happening that at the time feels overwhelming, there's overwhelming fear, terror, rage, we can't fight, we can't flee, that certain muscle groups lock up and tense, and oftentimes stay locked up and tense and frozen. Wilhelm Reich used the word armored, said there's muscular armoring to try to protect us. I think we're these areas of muscle tension in the body, and it can be anywhere. Any set of muscles, a lot of times it's the core muscles. The psoas is a huge muscle where those blockages happen, but we've seen them all throughout the body. Anywhere where you might feel chronic pain and tension could be a tension and bracing pattern in the body. I think that also contributes. Anyway, so how you do emotrance, how I do it, and I'm incorporating a little bit of my languaging that may be a little different than what Sylvia did, but I love the emotrance technique. So step one, you ask the client, think about the problem. Now you're not trying to get them to abreact and think about it and generate the most emotions they've ever had and anything like that. Or think about the person that bothers you. You want their mind just to safely touch on it, just to get an emotional response and notice where they can feel it in their body. Now, as a caveat to this, if someone can't feel emotions or sensations in their body, they're too frozen, they're too disassociated, they're too cut off, emotrance is not the technique for them. You got to try something else, okay? Step one, think about X. Think about the problem, the memory, the person who bothers you. Number two, notice where you feel it in your body, okay? Number three, we tell the clients if it's a place that's readily accessible, put one or both hands on that area, okay? Then I tell the patients the following. This is my language, and I say, notice the raw physical sensations that are there in this moment. The raw physical sensations. Let them be there. We're not trying to resist them, okay? Then I say, just for this moment, do your best to not put a label on it, like anger, guilt, sadness, hurt. Let's not label it. And just for this moment, would it be okay to not start thinking about it, to try and figure it out? We're not trying to make it positive. We're not trying to give a meaning to it. And again, this is a process of working with a client. One of the reasons why I'm good at this, I've actually embodied that pretty well. I mean, I actually can notice stuff as sensation without adding all these mental constructs after so many decades of my life being very good at adding layers of thought and thinking about and mental constructs. And then what we don't want also is the client making an image or a meaning or a metaphor. For example, I was working with this one lady recently, her hand was on her chest, and she says, oh, that's my ex-husband. So she had a raw sensation, but she was making a story or meaning to it. Now in her case, I said, listen, I'm sure your ex-husband's too big for his whole body to fit into this part of your chest. Notice raw physical sensations in this moment. Let it be there. And then I use the following words. I say, that's the feeling of stuck or blocked energy. Energy is meant to soften, and I give it time for it to soften, and flow. Our body has channels to move all this energy through and out. So I tell the client, just hold the thought, soften and flow, find a way through and out. Now, surprisingly often, the energy will soften and flow through and out of them. If it's here, it may flow up and out of their mouth. Sometimes it flows up and out of their head. Sometimes it flows into their arms and out their hands. Sometimes down their body and out from the area between their legs, or down the legs and out the feet. Now, sometimes it starts here, and we soften and flow it, and it moves down to their solar plexus, and it's stuck there. So I had them lay their hand there, notice raw physical sensations again, without thinking about it, figuring it out, adding meaning, trying to make it positive, making a metaphor out of it. That too is the feeling of stuck or blocked energy. Energy is meant to soften and flow. So just hold the thought, soften and flow, find a way through and out. And a lot of times it'll soften and flow further. Sometimes it happens faster than others. We're not using a lot of intention or willpower with this. Most of us are so used to wanting to force stuff. This is not an exercise where we're using a lot of willpower, a lot of strong intention. It's mild intent. It's not a visualization, it's a kinesthetic. You're feeling sensations moving through the body. Sometimes it moves from point A to point B, sometimes from point B to point C. A lot of folks, it'll move through and out. Then I'll have them go back, think about the person, situation, memory again, notice where they feel it in their body. Very often when they feel it again, it's substantially less intense. It may be in the same original place or in a different place. They'll put their hand there, notice it as raw physical sensation in this moment. Say soften and flow. That's just an energy. Find a way through and out. And we'll run that several times. Sylvia likes to get folks to this energized end state where the energy is just flowing in and through and out super fast, and they feel super energized. One thing that Sylvia says, and I've absolutely noticed this myself, when folks release these energy blockages, they literally sometimes get huge cognitive shifts. They reframe situations themselves. They have a totally new way of thinking about it or seeing it or remembering it, and it's absolutely phenomenal. I love this technique. I'm not currently teaching it just because my schedule's so busy, but I love Emotrance. Sylvia's got a great book called Emotrance. It's available on Amazon. Yeah, I love it. Now, I've had a little caveat where I've had I've had 3 or 4 people came to me and they said, I'm going to leave my spouse. I can't stand them. I'm going to leave my spouse. So we do the same process. I say, when you think about your husband, where do you feel it in your body? Here or here, somewhere. I say, put your hand there. Now, let's break this down again in a millisecond. We're going to take a snapshot. In a snapshot, they see or interact or think about their spouse. That's number 1. They get a sensation, a feeling, a bad feeling inside they don't like. Now, of course they want to leave them because they feel like crap every time they think about them. But what they're really feeling is a raw physical sensation before they start adding all these layers of thinking about, figuring out, all this other stuff. If I'm able to get the folks just to make that a raw physical sensation and not their actual spouse, realize that is the feeling of stuck or blocked energy, soften and flow it a few times. A lot of times at the end of the session, they can think about their spouse and it's like, boy, I could think about him or her. It doesn't bother me. I feel totally fine and neutral. I actually feel pretty expansive when I think about them. And at that point, there's no reason to leave the person. And so I feel like I've saved, 3, 4, 5 marriages just by working on one or both spouses, just doing the Emotrance technique. So it's usually not about all the little details that he said and she said and the toothpaste and whatever. So I'm talking about, of course, normal, relationships that have the normal ups and downs and that type thing. So that's Emotrance, and this is Eric Robbins signing off. Thank you.